I'm Penny Free, and I'm the Chief Clinical Officer and the Executive Vice President for Terros. Terros is a behavioral health organization in Phoenix, Arizona, and we see about over 20,000 people a year. We provide assistance to people who have problems with substance abuse, mental health difficulties, HIV. Prevention is another service we provide, and we have an annual budget of about $25 million a year, and we have about 400 employees. We've been in Phoenix for almost 40 years. The organization was actually started by a group of volunteers, young people who were concerned about a friend who had a substance abuse problem, and that group of friends could not find support in the community, and so they started this organization called Terros. The first major problem we identified was a problem in access to care, and we found that we were not able to get people into treatment as soon as they needed to be in treatment and as early as we wanted to get them into treatment. And we had, it took people about 17 days to get to treatment. We implemented a series of changes. We were very involved in a couple of different change teams in order to do that, and we reduced that number of days down to about 3.5 days to get into treatment on an average. We also, in that process, increased our admissions 80%, so we had a huge number of people who were coming into our treatment programs. This was initially somewhat of a concern because we were not prepared to take on the number of people who were needing help and were coming in to receive treatment. But we were able to have a compelling discussion with our funders, and we received an additional $1.5 million in that grant year. And we found that as our performance improved relative to access to care, our funders had greater confidence in us, and we received more funding. The NIATx model of improvement really utilizes a team approach and input from employees who are all invested in resolving it and improving a problem. We've found wonderful areas where our staff contribute on those teams. And in fact, last week I was at a presentation that one of our clinical staff provided, and she was showing slide after slide data set and graphs to our entire clinical workforce in our outpatient service, and focusing on improvements in engagement in a group treatment. She was so excited, and our staff, our larger staff, were so interested in this work. It was very exciting to me to see that involvement from clinicians in looking at data and looking at improvement in access to care. In helping us to maintain a strong and engaged workforce, I think that we are more prepared to face what we anticipate to be a very hard time for our delivery system in the next year or so, or longer. Our employee workforce is stronger. Our leadership, our leaders are stronger. They're more invested. They're more connected. I think the NIATx efforts that we have had have helped that occur. I also think we are more prepared because we have identified areas where we know that we can improve in efficiency and we can reduce additional waste, and that will ultimately help us use every dollar that is available to provide good care to our clients.